ఇప్పుడు మాట్లాడండి సార్. Is this voice audible now? Yes. So just we'll go back to the previous slides because of there is a technical issue, some of voice. So now today we are discussing about the basic facts of dengue fever, which we commonly see. I'm Dr. Sudheer, a critical care consultant from KIMS-Saveera Hospital. What is dengue fever? Dengue fever is a common communicable disease characterized by the occurrence of high fever, severe body aches, and intense headache. They commonly come with main complaint of fever with very high body pains that it is not bearable as my bones are breaking up. So it is commonly known as break bone fever. Hadi tud bukhar hai. Oh, so it causes severe intensity of pain in long bones, and the nature of headache, it is classically like retroorbital. They will complain, sir, beside my behind my eyes, I am getting very intense pain. This is the common type of description that the patient gives in this classical dengue type of fever. And it is caused by a virus known as dengue virus, and it has four sub-serologies. It is dengue 1, dengue 2, and dengue virus 3, and dengue virus 4. And it is a double-stranded RNA virus. It is a viral, you can see this viral genome, and it is a structure that the virus looks like. It is a nucleocapsid, the outer membrane, and viral envelope, and this protein for attachment to the nucleosides. And how does we get this dengue fever? Dengue fever is spread by a mosquito bite, and the mosquito known to which carry this dengue virus is Aedes aegypti, and it is commonly known as tiger mosquito. Also, you can see this white striations on this mosquito, and it is a very tough and bold mosquito where you can see the mosquito bites at daytime also, in bright light also, right? And more frequently it is seen in closely in rainy seasons and immediately after the rainy seasons, like July to October. But that doesn't mean that it will not occur in a summer or dry periods. It can occur in dry periods also, but more frequently we see in humid conditions. How does we get this mosquito? When this Aedes aegypti bites to a person and the person gets infected, and he will be growing all the dengue virus, and again new mosquito bites to that infected patient and goes and bite on a healthier person. And this is how this dengue fever is spread. It doesn't spread from a person to person. It spreads by a mosquito. What is the incubation period? Means the time that taken for an infected mosquito bite to the clinical appearance. If we had a bite of this Aedes aegypti mosquito with a dengue virus, and where we present with the clinical symptoms, it usually takes 5 to 6 days, and it can vary up from 3 to 10 days. This is the common scenario that we will present. Generally, the patient will give a history of travel. Sir, 1 week back we had a travel. Today I have been presenting with a fever. This is a common history because the mosquito bite may happen 5 to 6 days prior, and this is called incubation period, where no symptoms will be there. The first occurrence of the symptom after the bite is known as incubation period. What are the symptoms of this dengue disease? See, the symptoms of dengue disease depends upon the type of dengue fever. In that, we have a simply to classify it as a three types of fevers. It is a classical or simple dengue fever. Dengue fever with hemorrhagic signs, it is known as dengue hemorrhagic fever, and dengue with shock syndrome. So where we have a multi-organ dysfunction, where we talk in detail. Because this is classical simple dengue fever. This fever will be sudden in onset. From yesterday he will be fine. Today morning he will get high grades of fever with chills. Thandi lag raha hai, oh, common complaint they complain with fever with chills and severe headache and pain in muscles and joint. The patient will be complaining that so my every joint is paining, my every bone is pain, and classically about the pain they will describe my eyeballs are especially like pressing type of pain with the movement of eyeballs my headache is getting aggravated and change in taste sensation of the mouth, pain in abdomen by itself or by touch, or mild throat pain, or rashes on skin like pink color, red rashes appears on the skin in the diffuse form like mottling or just like pinhead eruptions seen on face, neck, or chest, and it can be later days. This is a common simple dengue fever symptoms which see in almost all every patient with high grade fever, headache, and loss of taste, and mild abdominal pain or mild throat pain. This is known as classical simple dengue fever. See, these are all the symptoms that the patient says. Retroorbital pain, like someone is pressing my eyes is getting pain. We see high grades of fever, more than 101 degrees, and muscle pain, and every joint is paining, and severe headache. And we can see the rashes like this, a pinpoint, a purple color, pin erupted lesions, which we typically see like this. It is seen in classical dengue fevers. What is about dengue hemorrhagic fever? See, the previous one is that classical symptoms of dengue fever. With that, additional manifestations of any bleeding signs like bleeding from nose or bleeding from gums or blood in stool or blood in vomiting or bloody spots in skin or sclera or conjunctival hemorrhages, and all these are known as hemorrhagic manifestation. Or if you go to a doctor, if he applies a BP cuff around your hand and inflate after removing it, that if you see a patches, then it is also classically known as a tourniquet test, and it will be positive. When all these symptoms are there, then it is known as dengue hemorrhagic fever. Means all the symptoms of dengue, classical, whatever we thought of fever, mild throat pain, or muscle pain, or headache, with that too, with this of additional any bleeding from nose, gum, or blood, then it is known as dengue hemorrhagic fever. How could we see this tourniquet test? Generally, the doctor or staff, whoever is seeing your blood pressure, when they apply the tourniquet, the BP cuff to your hand, and they will inflate to your systolic blood pressure and wait for minimum of 5 minutes and reduce it after 2 minutes. Then, if you see the petechial hemorrhage around the application spot, then that is known as positive test for tourniquet. It is earlier identified as dengue hemorrhagic shock. Some patients may not have any bleeding nose or bleeding gums or blood in stools. They usually come with a severe body pains or headache with the throat discomfort or abdominal pain. If we apply the BP cuff and we do just simple this test, if we see the petechiae around his hand, then we can diagnose as dengue as in hemorrhagic fever. What is dengue shock syndrome? See, whenever we listen this deaths due to dengue fever, that is due to when the patient goes into shock syndrome. This is the usual to say it is a deadly complication from where it is a simple dengue fever to where it be a life threatening, it is known as dengue shock syndrome. See, all the symptoms that we have mentioned in classical and dengue hemorrhagic, like all simple fever, myalgias, means body pains, joint pains, or retroorbital pain, headache, that too with hemorrhagic of bleeding nose and everything, and patient will be in shock. How we will know a patient is in shock? He will be very restless, he will be very tired, he will be restless, he will be not feeling comfortable, he will be feeling suffocated. If we touch him, he'll be cold and clammy, and in spite of high fever also, if we touch the patient, body will be very cool, and this person may start losing consciousness also. If you examine, the pulse will be very weak and rapid, and if you see the blood pressure will be low. So then that is known as shock syndrome. With all the features of both bleeding and simple fever with shock, it is known as dengue shock syndrome. It is a more life-threatening where the patient will leads into multi-organ failure, and even we may lose the patient from this stage. So it is a deadly thing of a dengue shock syndrome. The course of illness. See, the course of illness is more important to prognosticate or to know how the patient is responding or how much bad he goes. See, from the course of illness will be very simple. The patient will be getting a fever for 3 to 4 days with the intermittent. He might be taking his medication in OPD basis, and he finds comfortable. On the third or fourth day, his fever gets subsided, but then the main complication starts. See, if you see the fever spikes, usually the fever will be high in first 3 days. After that, the fever is getting down. Fever will be almost all his fever spikes will be almost all reduced. But the main other organ dysfunctions or platelet drop will occur from this stage. So that is more important. In first 3 days, patient will be clinically dehydrated, but all organs will be normal. The shock or bleeding signs will usually occur after 3 days to 6 days. And laboratory changes, if you go and if you have a check in a laboratories or wherever, if you go, your platelets and everything will be normal in first 2 to 3 days, and your hematocrit will be normal. After that, from third day to sixth day, all the changes will occur. Usually, the platelet will fall down from the third to fourth day. It started will be going down, and usually it will take around 4 to 6, and it may extend up to 10 days also. The where platelets will go down, and again you can see the platelet rise. Once the platelet is getting rise, usually the patient recovery from platelets will be good. This is the more concern about what we see in dengue fever about platelet. But we have all other things also rather than major issue, where we can see the hematocrit will be the normal at first initial 3 or 4 days. From fourth day to around 6 to 7 days, up to 10 days also, the hematocrit level will can go up and gradually it will decrease. And viremia, if you see the viral load also, initially the viral load will be high in 1 to 2, 3 days, where you can see. That is why the response of the fever is also high on first 3 days. After that, fever will be subsided, but all the secondary complications that we get after 3 days. And to know this, because the timing of test and timing of laboratory test is more important to diagnose the fever. In incubation period, if we have a mosquito bite, from the day of mosquito bite to the day of first sign of fever or headache or this is known as incubation period. It is usually 5 to 10 days, where the patient will be not having any signs, but he might have been bitten by this dengue infected mosquito. When after the patient gets symptoms from day one, usually it will take up to Day 4 or day 5, you can have fever spikes. Usually from day 3 to declining trend of fever spikes is seen, where the patient will have high viral load of dengue virus in his body. Where if we do test him after fever, after the second day of his illness to fifth day, usually we'll get dengue NS1 type of virus to get positive in the list, because the duration of illness is more important. If we do after third or fourth day, then we can get this IgM, dengue IgM or IgG positive. Usually IgG will be the late. Before IgM, you can see from day 3 or day 4, we can get dengue IgM positive. From day 8 or from day 7, then we can see IgG positive if we do a laboratory test for this dengue fever. So the duration of fever or illness, this is more important for diagnosing, and to get when to get tested, that is also important, because after getting a fever, just at day 1 doing all dengue NS1 IgM IgG, that doesn't make any mm, reliability. Based upon the fever number of duration of the fever, but by that we can go for a specific investigation that your doctors do. The other investigation that we generally do in this dengue fever is complete blood picture, because the platelets will be low and WBC count will be low. That we want to see that whether this due to this virus or any other cause to go your platelet down. We want to see. That's why we'll do complete a complete blood picture, liver function test, and renal function test, and abdominal ultrasound also. Generally, we use ultrasound also to diagnose this dengue fever, because the patient will be having mild abdominal pain in the presentation. We see all the classical features like bowel edema and minimal fluid collection known as mild ascites or basal lung pleural effusions or gallbladder edema. This all the serositis features of dengue fever. That is why we will do ultrasound also to substantiate this dengue fever and to see the other complications that we are not missing. See, to say the simple, we have three types of this. Whether dengue plus warning signs. See, dengue fever, it can be treated at home also if it is simple fever. And watching the warning signs is more important to prevent the death from dengue fever. So that is more important. See, probable dengue means like when the patient have a travel history to the endemic area, fever, you have a nausea or rash or body aches or tourniquet test positive or leukopenia. This all are signs into probable dengue. See, warning pains when you should be addressed by a doctor and in hospital admission, that is a warning signs where we should not treat him further in house. Like if he has abdominal pain or persistent vomiting, or if you see the facial swellings or foot or swelling his limbs, that any mucosal bleed, if patient is lethargic and restlessness, or if in ultrasound if you see liver enlargement, or in laboratory when you go test and see the hematocrit level is increasing or platelet count is decreasing. This all are the warning signs where patient should be addressed at hospital. This stage of recognition is more important. See, once you come to the hospital after setting the shock in multi-organ failure, the recovery patient will be very low. Before going to that stage only, if we go and treat, we may come out with all these stages and preventing him onto multi-organ dysfunction. And what about the criteria of severe dengue? Severe dengue is like shock. His BP will be not recordable. His total face or body total anasarca, we'll call as an anasarca, where total his body will be swelling and bleeding from any side like nose or mouth, or through bloody vomitings or through stools, and any organ dysfunction. If we do any laboratory functions, their liver dysfunction or CNS impairment is in consciousness, and this all are the criteria of severe dengue fever. So we should be careful in this warning sign stage. We should not overlook it, where the patient, if present in this stage, we can prevent him to landing up into severe dengue, right? These are the predictors of severe dengue, where which age group of patients, generally young patients and infants, and age 11 less than 11 years are the patients who are going to become more sicker, and Caucasian and race and AB blood group have likely to go into severe dengue. And warning signs like abdominal pain or hepatomegaly or lethargic, if patient has been touched, it is cold and clammy, and platelets less than 75,000, or hematocrit greater than 50% or increased by 22% from the baseline. This all are the warning signs, which we should not miss this and getting into more complicated state. See, what do the doctors do when we get a dengue fever? For a simple dengue fever, it can be managed at home. Treatment is purely supportive and symptomatic. There is no specific treatment. It is clearly symptomatic and supportive. Means like keeping fever low just by giving simple paracetamol and taking of plenty of oral fluids, and like which is called shaginji, like this liquid diet to accept more, and continue the normal feed and allow the patient to take rest. These are the simple measures that can be treated for a simple dengue fever. Usually, if these steps we take adequately, we have a likely chances to reduce the patient to land up into dengue hemorrhagic or dengue shock syndrome, which are life threatening. See, if any symptoms of, as we discussed it previously, like dengue hemorrhagic manifestations or dengue shock syndrome, then rush the patient to the nearest hospital as early as possible, whenever, and get an appropriate investigation that to be carried out and necessary treatments that should be instituted. Even dengue hemorrhagic shock and dengue hemorrhagic fever and dengue shock syndrome can be managed successfully if we had correct diagnosis and made a treatment as early as possible. That's why recognizing the warning signs is more important to save the patient. Please remember that every patient doesn't require blood products like platelets transfusion. Right? See, what about platelet transfusion? Whenever we talk about dengue, the only concern will be, sir, when our patient get platelets, how much platelets we need, when we get transfused, why we are not transfusing. These are the common questions that we get during this dengue fever. See, there is no role of giving prophylactic transfusion. Matlab, oh, if platelet is going to decrease, so I want to give platelet. No, it doesn't work like that. So, ideally, if platelet is transfusion is indicated if platelet count is less than 10,000 per microliter only. But in general practitioner job, what we use is if we transfuse less than 20,000, then only we transfuse these platelets. Or else, if patient is having any signs of like bleeding from nose or bleeding from stools or bleeding from vomitings or drop in HB, then irrespective of his platelet count, even his platelet count may be 50,000, but he's bleeding from nose, then we will transfuse the platelets, right? Usually, if a platelet is less than 75,000, what we do is that just we give the supportive management to control his fever and give fluids, and we monitor his platelet count every 12th hourly, in the morning and evening. We do. See, the trend of platelet count is more important than rather the individual count, because if we do morning as platelet count is for example 75,000, by evening it has drastically come down to 30. That is more worrisome than the number of value of 30, because rapidly from morning to evening itself it has come down from 75,000 to 30,000. So the trend of decreasing count is more dangerous rather than a single value, and we transfuse only if platelets is less than 10,000 or less than 20,000, or any bleeding manifestation. By Many people will have a doubt of saying that, sir, however, we are expecting to go the platelet down now 50,000. Why to take that stage? Let's give in this 50,000. No, it doesn't work like that. It will cause more complications rather than helping the patient. So, no role of prophylactic transfusions. We have many myths and fact about dengue fever. So, general public awareness that we want to clarify it. A person can be infected with dengue fever only once in his lifetime. So many people think that if once we get dengue fever, again we are not going to get it. No, that is a myth. The fact is that we have four strains of dengue viruses, and each time we can get only any one type of dengue strain fever. So, an infected person, the same person can get dengue fever next year also with a different strain or the same strain. That doesn't mean he will not have any type of dengue fever in next of his life. No, that will not happen. He can get dengue fever. Another myth is that what we have is dengue fever. Is it contagious and it can spread from person to person? No, it cannot be spread from one person to other person. It is only spreaded by a mosquito bite known as Aedes aegypti mosquito. So infected person gets a bite from this mosquito, then he will be infected, not by person to person. Another, that any mosquito bite can lead to dengue fever? No, it is only cause only which can carry this dengue virus is known as Aedes aegypti mosquito. Only by this mosquito bite only will get dengue fever. Not with every mosquito bite we can have a dengue, right? And dengue fever is always associated with low platelet count. No, low platelet count can be one of the symptoms in severe dengue. Not an, if you see in a classical dengue where platelet count can be normal, there can be lot of viral and bacterial infections where you can see the low platelets. Only in dengue we can't see this low platelets. We can see in other viral also, other fever also. That is platelet transfusion needed every time one the patient get infected? This is another myth that we have. No, normally the normal platelet count is 1.5 lakhs to 4 lakhs, and transfusion is done only when it falls below 10,000 to 20,000. In healthy individual, will wait up to 10,000 in inpatient. In high risk patients with underlying comorbidities, we have transfusion 20,000. Okay. Mosquitoes bite, this dengue mosquito bite will cause only in dirty water. This is another strong myth that we have. Generally, the patient will be coming and saying, "Sir, we don't have any dirty places," or no. Even in your flower pot, water stagnant. Even in that clean area, also this mosquito can grow. That is why we called it as a bold and brave mosquito. Where in healthy atmosphere also it can grow, and it will bite in at daytime. So that is another myth that we usually have. Can this dengue fever be can seen in only adults, or so irrespective of age or socioeconomic status or immune status? it can be affected to any type of person. We can get this dengue fever. It can occur in older age or young age. The more complications we see in infants and young age less than 11 years. But that doesn't mean the young patients will, like 20 to 30 years, they can also get infected. In 40 to 50 years, they can also get infected, irrespective of their immune status or underlying comorbidities. These are the common myths that we have about this dengue fever. See, this is a chart how we see in hospital what doctors do every time. We'll be thinking of the treatment that we are getting for this dengue fever. See, but simple is that we will give crystalloids solutions of 10 to 12 ml per kg in first hour, and we will see the improvement in this BP, in heart rates, and everything. By thus, if it is improved, we will decrease the administration of dose of IV salines, and we see the response. And we check the hematocrit levels every fourth and sixth hourly in the initial stages if it is in severe shock. And based on his hematocrit levels, again we will be increasing the fluid resuscitation that we needed. Or if it is improving trend, we will decrease the fluids. The main stay of treatment is just supportive by giving fluids and addressing the fever with simple antipyretics like paracetamol. See, always any disease, the prevention is much more better than cure. That we always know. How can we prevent? See, the elimination of breeding points for water is more important, where we commonly seen in our any plant pots and everything. And staying in indoor, outdoor, we have more mosquito bites when we come to indoor, and using all mosquito repellents or creams that are available commercially, and using of mosquito nets to prevent biting, and wearing protective clothes when we go outdoor or during night time to prevent this mosquito bite. A simple this mosquito can bite can prevent from a dangerous action of this dengue fever. And even it is a more burden in society, and we can see the more number of death that is more worrisome with dengue fever. And we have a national dengue day also. It is celebrated on 16th May of every year. The action that was last year was build a stronger nation for the safer community by elimination or preventing this dengue fevers by taking all the actions that are shown for prevention. Thank you. Any doubts? We can go ahead.